My name is Ashley Alvarez. This is my oral presentation for Dr. Fulton at Midwestern State University. The journal of choice I picked was Humanized Mouse Models of Rheumatoid Arthritis for Studies on Immunopathogenesis and Preclinical Testing of Cell-Based Therapies, written and reviewed by Katina Schreinerling, Carlos Rosas, Lillian Soto, Rajani Thomas, and Juan Carlos Aguilon. In the article written by Brazier, she says, rheumatoid arthritis is a long-term progressive and disabling autoimmune disease. It causes inflammation, swelling, and pain in and around the joints and other body organs. There are 3 current treatments for RA: non-steroidal anti-inflammatory drugs, glucocorticoids, and disease-modifying anti-rheumatic drugs. All these offer a way to reduce the pain and the deterioration of the cartilage and synovial fluid. They're helpful but require a lifelong treatment. Dr. Schreinerling, Rosas, Soto, Thomas, and Aguilon have been experimenting with the way to cure RA using the patient's own T cells, a natural way. In the journal, Schreinerling writes, 2 main strategies have been pursued for humanization, talking about the humanization of mice. 1. The introduction of human transgenes such as human leukocytes, antigen molecules, or specific T cell receptors, and the generation of mouse-human chimera by transferring human cells or tissues into immunodeficient mice. TREG maintain immunological tolerance and prevent autoimmune diseases by suppressing the activation and proliferation of self-reactive effector T cells. The TREG is a T cell that's been modified. And here in the methods section, they start by the expansion of autoantigen-specific, naturally occurring TREG cells in vivo. In vivo means that from the human patient. So I put on here, taking TREG cells from synovial fluid from the patient. The second part is the conversion of antigen-specific T cells into TREG cells in vitro, which means in test tubes. I put reprogramming or depleting the TREG cells to reduce the amount of autoreactive lymphocyte responses. The third step is their propagation in vitro and the subsequent transfer back into the host. This means that they're growing more modified TREG cells and returning it back to the patient to test if the reprogrammed TREG cells worked. The purpose of all this research is to find a cure for autoimmune diseases. I put autoimmune diseases, not just rheumatoid arthritis, because they all work almost the same way, where the immune system attacks itself. So if this does work, it may be used to cure other autoimmune diseases such as psoriasis. This experiment has great potential and is still at preclinical trials, but there is hope that soon in the future they will be able to start cell therapy for rheumatoid arthritis. This is my reaction that I put up. I put rheumatoid arthritis plus modified TREG cells equals a cure for autoimmune diseases such as RA and psoriasis. The equipment used, not very advanced equipment. A syringe was used to inject the humanized mouse with collagen-induced arthritis to mimic what a human would go through when they have RA. The other equipment that was used was a arthroscopic OCT probe. This probe is inserted in a small incision on the knee and takes a small sample of synovial stem cells. The synovial graft, or stem cells, is used to take out the Treg cells, modify them, and then put it back into the host. The results of this experiment was an issue of translating the cell therapy from mice to men. It's not sufficient enough to take to clinical trials because there's an issue with the T helper 1 cells. The limitations are it's difficult to recreate the humanized mice using both the methods by other scientists or in other labs. And also the disappearance of antigen presenting cells. These are the cells that the T helper cells bind to get the reaction going. In conclusion, this experiment is still in preclinical lab trials. There is much hope for the future, and the results show there is great confidence in succeeding in future trials. This is exciting because my dad actually suffers from rheumatoid arthritis, and I hope that one day he won't have to suffer anymore and he'll be able to get a graft of Treg cells and be able to produce or stop the deterioration of the cartilage and synovial fluid. And these are just my works cited. Thank you.